everyone. My name is Alex Keller. I'm here with my friend Jeff Glad, and along with our other friend Holly Lucille, we lead the medical team at Fullscript. And it's been a crazy few months. I think for everybody, we're really trying to find our place in this new normal, and a big part of that we've been trying to do is get insights from everywhere in the industry. And so we're particularly excited today to be welcoming two incredible, influential, and inspiring guests to be joining us on this podcast. And I'll let Jeff explain a little bit more, but to be also welcoming Dr. Tieraona Low Dog as a member of our team and our family is also a really exciting time, especially with everything that's happening right now. So Jeff, do you want to explain to everybody a little bit of your background with Dr. Low Dog and how we got to this point? And maybe also talk a little bit about your own joining of Fullscript about 8 months ago now. I don't know if everybody on the call knows that Jeff is our Chief Medical Officer, and give some reasoning and a bit of a story of why you wanted to join Fullscript as well.
Yeah, sure. Thanks. I'll start there. So my desire, I had my own private clinic for 10 years, and it's been very successful and everything I've wanted it to be. But I'm not, making enough of an impact at the national and bigger scale, and have been a very passionate advocate for technology and streamlining practices and being able to kind of for everyone to practice their dream practice, which I think Fullscript is one of those tools. So to be able to work with a team who's dedicated to changing the way health is prescribed has been a dream of mine, and it's been a joy ever since the fall. One of the tasks asked of me in this role was help build an advisory board of professionals and leaders in the field. And so that's been a fun thing that you and I have been doing, Alex, ever since I started. But the first name that came up in our first meeting and sort of, always stayed near the top was Tieraona Low Dog. And I met Tieraona when I started in 2008. I started my integrative journey through the University of Arizona, training with the fellowship program. And just the presence and the wisdom and the knowledge and the passion is always inspiring. And so we've remained good friends ever since and have worked on several different projects together. She was always bringing me into projects that she was working on, and I was always looking for a way to reciprocate and be able to bring her onto one of my projects. And so this is one of my favorite projects, is to sort of build this advisory board, which we'll be announcing soon. But incredibly excited to have her, and then another great friend started in the industry and now just a true friend in James Maskell, who has refined his vision and passion by doing all the podcasting and the functional forums and all the teaching he's doing. And so you and I are just itching to get out of the way of these two forces in the field, and just bring them together to talk about where we're at today in integrative and functional medicine, where we could be going, and just sort of have this high level discussion that Fullscript wants to be a part of all these conversations. And we want to start that, by bringing these two to you right now.
Yeah, exactly. So without further ado, let's welcome James Maskell and Dr. Tieraona Low Dog, and they will be taking it away for the rest of this webinar. Thanks again to everyone for joining us today.
Thanks, Alex. Thanks, Jeff, for the beginning. It's an honor to be here and to be participating in this event. And Doc, I just want to first acknowledge you as sort of like someone that I've always wanted to have this kind of dialogue with, to have you on the functional forum. Been a little bit elusive so far, but I'm glad that we get to do this today. And I guess, when I first went to the AIHM conference and heard you speak, what I noticed, what Jeff said there, was just the reverence that there is for you in the industry, as a leader and as a communicator, and as someone who really represents, I feel like, the heart of the industry, and I recognize that in you. So I know we've got a lot of things to talk about here. There's a lot of relevant things. Even when we booked this call, the world has changed significantly since then. But I guess I want to start with your own experience of this COVID lockdown and crisis, because I know that you've had a sort of a deeply personal interaction with it, and I would just love to know a little bit more about that, if you could share with our audience, and what you've learned through that process.
Sure. And it's a delight to be here with you, James. So the admiration is very mutual there. You know, so it was interesting. My husband and I went to China in December, and we were in a number of areas in China at some very large scientific conferences. And towards the very end of the 10 days we were there, I began to definitely feel like I was coming down with something, and we got home, and I was sick, and I figured it was the flu, like a bad case of the flu. I developed pneumonia, and you know, my husband's always like, I need to take you in, and I'm like, I know it's pneumonia. You know, it's like, I know what it is. It's probably the flu. I'll be fine. It hung on though for about 10 days, and then it was a few weeks later that we heard about the coronavirus and COVID in China, and we had been in the area. And so, you know, it was kind of like, well, I wonder if that's what it was. Well, we just keep moving along. And then March 6th, my daughter had been in New York and then in San Diego, and she called and said that she was not feeling well. And she got home, she was living in Denver, and she was admitted to the hospital on March 8th in acute respiratory failure with hypoxia. And it was an 8-week battle, multiple hospital admissions. She was saturating, her oxygen saturation on room air was in the high 60s. She was requiring 4 and 5 liters of oxygen. She was on steroids and nebulizers, and then she had cardiac involvement, and so we were getting, you know, in and out of AFib, and then we were getting echocardiograms, and I wasn't sure, you know, there was some moments there I was pretty worried that we might lose her. I mean, she was really very, very sick, and we brought her down to the ranch. It was like, okay, you need to come home where I can take care of you and can really lay eyes on you, because I'd traveled to Denver, but of course you can't go into the hospital or anything. So it was also very difficult to manage her care. So we brought her home. At the same time, my mother had been in the hospital with pneumonia, COVID negative, but she came out, and my father got sick, and he was in hospice, and he died on April 15th. So we were down managing his care because hospice couldn't come to the house. So I was his hospice provider, essentially, managing his medicine and managing his care as he was transitioning from this life. 2 weeks later, my brother was in kidney failure, and we got him back in the hospital, and he is both in kidney and liver failure, secondary to metastatic cancer, and my mother is in hospice and failing. So, you know, it was a lot. When you talk about sort of a lot of things happening, everybody except my son, who's here at the ranch with me, everybody was sick, and we lost my father. I was very worried we were going to lose our girl, and my mother was hospitalized. So it's been quite a ride, and my heart really goes out to people who either have been sick themselves or caring for somebody who has been sick, or just the difficulty with people trying to manage their own health care. It's like people who couldn't get their acupuncture with chronic pain, people that couldn't go for their massage, people that couldn't go get their dental cleaning, people that couldn't just go see the cardiologist because it wasn't an acute event. I think that this is really this social distancing and this pandemic, which all of us should have known was going to happen at some point. I mean, we have a growing problem with antibiotic resistance. We know that there are a number of infections that are on the urgent and threatening list for infections that are bacterial or fungal based that we can't treat. And then this virus coming through. So it's been a challenging time being a patient, being a provider, being a daughter, being a sister, and being a clinician in the middle of all of this. So yeah, and Kiara, our daughter, I have to say, is is doing great and is back to normal, but she about a week ago developed a fever. So her primary care provider was like, well, I want you back on antibiotics and I want you back on, there was this rush to that. And I was like, stop for a moment, let's get a chest x-ray. Let's see what your lungs look like, because her lungs were damaged probably permanently from the virus. But her chest x-ray came back fine. And I told her, I said, there's going to be this difficult period that you go through whenever you've been really sick, like somebody who's had cancer or somebody who's had a heart attack or somebody who's been really sick. There is a window of time when anything that goes wrong that your body feels, you feel like the cancer's come back or there's something wrong with your heart, or in Chiara's case, the virus is back. And it takes some time for you to remember what it was to be well and to begin to trust your body again, that it can find its way back to wellness, and to remember what wellness feels like. So that was kind of an interesting thing that just kind of popped up, that the journey isn't over, the journey continues. But I do know this as a clinician, this has always been something that I've observed, is that when people get very sick, there's a part of you that may feel like your body, you can't trust it because it got so sick. And I would say that your body was really, if it came through, you're still here, your body did its job, and you need to give it what it needs to find its way back to wellness, but you need to remember what wellness looks and feels like so that you can hold on to that.
Yeah, I'd love to that's such a great point. I've been thinking about that a lot recently, actually, in that if you look at all the things that are common to functional, integrative, naturopathic, lifestyle medicine, part of it is helping the patient to really realize that they're going to be an active participant in their health. And that roadblock that you just shared there, I think, is a critical thing that I think as clinicians get more sophisticated and more experienced, they realize that that's the real work at the beginning. And I'd love to just get your insight, that what you've learned over time of how to sort of flick that switch in people.
Well, it's always about the story, right? So for every single person that's come into my life as a clinician or just an acquaintance, it's always about their story and where they come from. And then I often like to ask, what do you think your body is trying to tell us? Like, not what your head is, but like, what do you, when you're feeling these things, what are you feeling? So Chiara talked about grief, like this was all in her lungs. And then she talked about just like this grief that she was feeling. Sometimes people talk about sadness or anger or stress or all the things that come out. And that usually is your hook, right? You have to find the hook. And once you find it, then you can begin to have that conversation with that individual about how do they envision getting better, and what does that look like? And that's always where we use that 1 to 10 trick. And I know a lot of people listening probably do it too, but I learned it when I was in med school and I loved it. But it's like, okay, on a scale of 1 to 10, how bad is your pain, for example, right? And it's like, oh, it's 100, and it's like, well, 10 is like yanking your fingernails back, while you're awake. So that's 10. So where's your pain? And then people are like, well, like an 8. And I said, so 8. I said, so how confident are you that you could get your pain down to a 5 or something like this? And then that's usually where that can be all over the place. But if they give me any number like a 4 or 3 or something like that, I'm like, that's fantastic, which is usually when the residents go, that's fantastic. She said it was like a 4, because what that tells me is that it wasn't a 0. It means that they believe somewhere inside of them that they know that they can get better, that they can get their pain better, that there's a part of them that believes that, because without their belief in it, you're never going to get anywhere. They have to believe that there's a possibility for them to get better. And then from then you begin to see, well, what are the things that could get in your way? What do you think is keeping your body from finding its way back to wellness? Like, what's getting in the way of that? If the body is self-healing, what's getting in the way? Like what's tripping you up? And then that is an interesting conversation, because you have to say it in a way that people don't feel like you're blaming them for their sickness, because that's not what it's about. But it is about, are you under too much stress? Are you carrying 50 pounds too much weight? I mean, is it that you never sleep well, that you've lost your passion, that you're in a terrible relationship? I mean, what is it that's keeping you from experiencing better health and wellness? And that's when people begin to come in to what you and I practice: functional or integrative medicine, naturopathic medicine. Any good clinician is going to try to find those leverage points that are going to allow them to become a good partner for this person, because it's a partnership. And the big mistake I see young clinicians do is they're just like, okay, so this is it. So you need to eat an anti-inflammatory diet, and I need you to take multivitamin, and you got to be on vitamin D, and I need you exercising 30 minutes a day, and you need to meditate and levitate. You need to, and what you've just done is you've just now, without any input from them, told them everything you believe they need. And a lot of times those patients don't even come back because they're overwhelmed by what you just told them. And usually I like the residents when they're very young, or the fellows, I would say, when they would come up with these treatment plans, I'm like, oh, I love that. I think that's a great one for you to give that patient. I'd like you to wait and hold off on doing it until you've done that for a month. And then you come back and let me know how that's all working for you. Which at most point people are like, oh my God, Yeah. So James, I think for us, it's all about not seeing the patient as broken. They're not a broken person. They're somebody that's coming, seeking help, partnership, because they want to feel better. And then listening to their story and finding within their story those hooks that give you insights into their strength, insights into where they're struggling, and that then you can partner together to help them create a path for themselves that will begin to take them on a better way towards health and wholeness.
I love that you said that. And I've actually, in the last couple of months, I've been actually interviewing patients of functional medicine clinicians, some people that had dramatic transformations in their health, and some people that thought, what the hell was that? What just happened? Like, they just really didn't have any context for what was happening. And one of the phrases that I've heard time and time again is it became like taking care of their health was a full-time job. And if you go back to what you said at the beginning there, which I thought was really powerful, is the fact that in a certain way, we're trying to get people out of that mentality, right? We're trying to get them out of this like stress trauma response of the fact that my body doesn't seem to work like everyone else's, and why have I got this chronic illness? And just by stacking this list of things that they should be doing on top of a list of things they already have in their head, they already know they shouldn't be doing, ultimately we're not helping them sort of take that first step. And I love I love what you shared there. I think it's really, really important, because I've interviewed doctors from all across the spectrum of experience, and what I start to see is at the beginning the protocol is everything, and then over time you start to see that actually the relationship is everything, right?
Yeah, absolutely.
So, obviously COVID was a big deal, and thank you for sharing that, by the way, about, what was going on in your family. And I'm sure that was traumatic in its own right. Since then, right, since we actually booked this call and we started putting the marketing out, obviously we've had the death of George Floyd. We've had this sort of movement all over the country of, riots and sort of protests and those kind of things. As someone with indigenous wisdom to share and coming from that lineage, what is your outlook on this? First of all, in just sort of like a social thing, and then I really want to talk about this, like, what does this mean for the delivery of care and the delivery of integrative care?
So I can only speak from my own wisdom and experience. I don't speak for any group or nation of people. Here in New Mexico, it's been our indigenous peoples, the Navajo and Pueblo, who have been most adversely affected by the death, and also carried the biggest burden of COVID here. So when we look across the United States and we see who has been most impacted by this pandemic, we see that it has affected poor people, people who tend to work jobs that don't have a lot of protection, where, you know, if you're a housekeeper, you're not doing that virtually, right? If you're a cook at the school, you're not doing that virtually. The schools were closed, and that when people live paycheck to paycheck, there often is very little cushion for this. And $1,200 check, you know, it's like, I know people that it took like 2 months to get. I mean, even the check that was there to help them. We also know that there's a disproportionate amount of disease that exists, chronic disease burden in many of our communities of color, but also people that are socioeconomically disadvantaged. And those often go hand in hand. When you see you know, it's interesting because we've had this conversation in our house. My son is here right now, but the conversation about, you know, what do you do if you get stopped by the police? I mean, I think many of us have had conversations with our kids. And as a woman, my daughter would tell you, if you interviewed her, oh my God, from the time I was really young, my mom would be like, okay, if you get stopped and it's late at night and it's, you know, you're out in the middle of nowhere, you just put your flashing lights on and you don't stop for the police until you get to a well-lit area. I said, and you know, and you make sure you're in a well-lit area. And if somebody wants you to get into a car with them, a police car, you say, no, I need a policewoman to be here. And people used to look at me and be like, why would you tell your daughter something like that? And I'm like, how could you not? Our son, it was like, you know, pull your pants up, you know, don't wear hoodies, put your hands on the steering wheel. He was stopped in Dallas going with 3 of his friends to go visit his grandparents, and they weren't doing anything, got him out of the car, threw him up against the car, patted him down. He just asked, you know, was I doing something wrong, sir? Did I do something wrong? And it was like, shut up unless you want to see the inside of a Dallas jail, you know? And so these things happen. This is our lived experience. And many people have this. And so, you know, you saw this man laying on the ground saying he couldn't breathe, and somebody with his hands in his pocket in a position of authority, not taking his knee off his neck. And how I believe everybody in the United States who saw that was outraged because it just looked so horrific. But you wonder how often these things happen when there's not videos. So, you know, I guess the long and short of this is that there's a lot of trauma that groups of people carry in their lineage that is brought down generationally. And it's not just if your mother was exposed to lead in utero that we're going to see multi-generational effects of that lead exposure, but if there was abuse, if there was significant discrimination, if these things were a part of a lived experience of a family, you're probably going to see that for generations. So I'm about healing. I mean, I'm about healing. I think it's about how do we go forward. But while these protests, I don't support the looting and all that kind of stuff. That's nobody should be supporting that. But the protests and the outrage, it doesn't do any good to talk very quietly. Sometimes you have to be much louder to be heard, and it spills over into the healthcare. It spills into your and my profession, and the childhood traumas, adverse child traumas, the things that we see with ACEs and things like that. We know that that's part of the story of many of our patients, and that's why I said at the beginning, it's listening to the story and seeing where you can kind of come in. You know, when you talk to an older woman who's got chronic pelvic pain, who's now had 3 laparotomies, they've removed her uterus, everything's done, and she still has it. Now she's on antidepressants because it's in her mind that she has chronic pelvic pain. It's clearly that it's a psychiatric illness. And one day when you're just listening to the story and you're asking her to share with you, where do you think this comes from? And in a quiet moment of sharing, she says, I was molested as a child. And that's where all of this got stored, right? And so you can remove her uterus, and you can give her laparotomies, you can put her on antipsychotics and antidepressants. But the reality was her body was trying to express what actually her mind and her heart just couldn't say out loud. And her body was just screaming for somebody to listen. So, here we are in a time of great change, and on so many levels. And I would say that now it's more important than ever to hold fast to the things that nourish, nurture you, and sustain you, whatever that is for your family, that the center still holds. That didn't change. Everything we've always known about managing your stress, getting a good night's sleep, eating a good dinner, doing all those things, maintaining healthy relationships and that, it's more true than ever today, for you to hold on to that. And it makes me feel very glad that we're in what we do: functional medicine, integrative medicine, naturopathic medicine, traditional Chinese, wherever there's a sense of wholeness and helping people to find and hold that wholeness. I think it's more important right now than it ever has been.
Yeah, I love that. And I guess there's a couple of things I want to just pull out from what you said that I think are very impactful for practitioners. One is this idea of transgenerational epigenetics, which I think we've all seen maybe in the literature when it comes to toxins, right? There's the most obvious version of it is toxins, but this intergenerational stress that's being brought down. And now we understand that there are transgenerational epigenetics. It helps us to understand the mechanism. And I guess one of the things I wanted to pull out there too is just the role of trauma in how poor health is created. And last year when I was researching my book on group visits, I had an opportunity to sit in group visits that were happening in federally qualified healthcare centers and places where poor people were getting healthcare. And I think trauma, that there are traumatic things that are happening all the time to people that some people couldn't afford to avoid, right? They don't have to experience those kind of things. And so when you start working with that population, which part of my feeling for this decade for me is really about how do we get this kind of care to those kind of people. And I think that as clinicians who are going to work with those kind of people, we can't underestimate the fact that in certain cases, one, these aren't lifestyle diseases, right? These are diseases that are born from trauma that some people can't afford. This is systemic oppression sort of happening there. And we have to be careful with the language you use, because not all of these are choices that we can make. And also that trauma, for the reasons you just said, reinforces unhealthy behaviors, because in that woman's case, for example, there had to be some physiological mechanism to go from the abuse to the the manifestation of the condition, and that normally looks like unhealthy behaviors consistently happening over time, right?
Right.
Yeah, it's
it is. I loved when I was in my medical school training at University of New Mexico. In my fourth year, I did my elective rotation, or one of my rotations that you were allowed to do. I did it at Healthcare for the Homeless, and I really wanted to work with people who were homeless, and to understand, how do you deliver healthcare to people who don't have a home, don't have a refrigerator, don't have a place to put things? How do they get a job if they don't have a phone, if there's not an address? How do they get social services? I mean, it was really interesting. And when I had somebody who wasn't ready, wasn't necessary that he had to go to the hospital, but couldn't just go back out on the street, and trying to call our local places, shelters that would take people, and well, he's a frequent flyer, we don't want him back. He wasn't well behaved last time. And it was just a really interesting experience for me to grow that part of empathy inside of me, but also deepen my understanding of the real struggles that exist. And then I did my continuity clinic at Indian Health Service. So in family medicine, I was in family medicine, so you have a continuity clinic. And my continuity clinic was at IHS. And that was also one, it was a wonderful experience because of the people I was able to work with that were my patients, that let me come into their lives. But it also raised a lot of issues about moving from the reservation to an urban setting. challenges that people had, leaving a very tight family structure to being more isolated in a city. And so when I went to integrative medicine and was running the fellowship down at the University of Arizona, you know, I would hear this mantra that like functional medicine or integrative medicine was for the worried well. And I was like, what are you talking about? And it's like, well, it's only for the rich people. It's, you know, it's not for the normal person out in there. And I just want to personally say that I absolutely do not believe that that is true. I believe that integrative medicine is it's a way that you view the world, or functional medicine, good medicine. It's how you see the world, the philosophy in which you hold the patient in that center, and that integrative medicine, lifestyle medicine, functional medicine, naturopathic medicine, whatever profession it is, it has to be able to be applicable to all people across different socioeconomic barriers and racial and ethnic. And if it can't, it was not ever a medicine I wanted to practice. So I absolutely, you know, herbal medicine, it costs so much. And I'm like, teas don't cost anything. And you can grow them in a pot. It costs you $3 for the seeds. And if it's a perennial, you'll have it forever. I mean, so some of this is absolutely not true. And I do think it's very important. And I love organizations like I Am For Us and others that are working to really bring this kind of medicine. You got it. It's a big bottle too. But to bring this to people for whom it may make the most difference.
Yeah, absolutely. I really appreciate you saying that. Look, and for everyone who's listening, there will be an opportunity for questions. So please keep the questions coming in, and we will have a question piece there. I want to come back to bringing our communities together in a minute, but I do want to talk about telemedicine for a minute, because, you know, ultimately, you know, I wrote a book a few years ago where I encouraged doctors to build a telemedicine practice, and Dr. Glad, who was here at the beginning, was actually kind of the hero of that first book, because, you know, ultimately what I saw is that with a small practice but a large digital presence, he was able to sort of run a bigger practice than his physical space allowed. And it turns out, you know, that those kind of practices were very resilient to this shift in COVID, where not just the functional and integrated medicine world, but a lot of primary care and family medicine was furloughed and out of business, still is in a lot of places because of this. And I guess I just wanted to ask you the question about telehealth and what your experience was with it, and specifically, you know, whether or not this sort of like break in the inertia that we've experienced could be a moment for integrative principles and functional medicine to sort of make it into the mainstream.
Yeah, well, first, I think that people are not going to want to not have telehealth and telemedicine because they couldn't access it. They were able to use it for the first time with their primary care provider or with their, you know, oncologist. And they were like, I can be home. I can be in my house. I can have this appointment. I can talk to my provider, my professional. And it was fabulous. So I don't think that's going to go away. I think we'll continue to deal with some of the issues around security and safety and some of these kinds of things. But you wait, the technology is going to get so sophisticated that we're going to be able to do so much online that is actually going to, just like Dr. Glad, who is one of my heroes. He may have been one of the heroes in your book, but he's a hero of mine, period. But he's a great guy. But you know, he's a very digitally savvy physician, and he has a lot to offer. And so him being able to increase his reach outside of just his local community is very powerful, right? So, and group visits can be done. I mean, there's all kinds of things. I think we're just seeing the very beginning of it. And then it's interesting for me because I realize that there is, that I have had to learn how to have that touch with people when we're not actually in a room together. And have had to sharpen and hone my own skills, become a better clinician, because so much of my interactions with a patient, I think, take place on a deeper level. I mean, it's reading body language, it's listening to the things that are not said, it's the way the eyes move up when I ask a certain question. And so doing that in this kind of world where I'm not physically touching them, I've had to learn to adapt. So I think many of us are kind of maybe an intuitive kind of, that we're going to have to adapt to that. And then of course it's not that practical. I have a friend who is an acupuncturist, but he did a lot of his visits more with Chinese herbs and nutrition because he actually couldn't deliver the acupuncture. Massage therapists were hit very hard by this because they could not practice, and they are such a hands-on. They were doing self-massage, they were doing things. I saw some very clever things going on. You know, clever people, good clinicians are always going to find some way to deliver their message and their gift of healing. But I think it's a fascinating time. I don't think we're ever going back. I think telehealth and telemedicine will continue to grow. And I think it will allow functional medicine and integrative medicine a broader reach, because people are always asking, where do I find a doctor like you? Or where can I find somebody like, and you can say, well, you can find me. We can Skype. We can do something online. I think it's not, the genie's out of the bottle. I think we're not going back.
Yeah, one thing that I interviewed a doctor who's been doing a lot of telemedicine, and he gave me a very interesting insight. I love your thoughts on. He said, you know, ultimately with functional and integrated medicine, we're talking about medicine that is environment based. Like, what does your environment look like? And one of the things that we now have a window into, right? So I guess I just want to give the example. So one-on-one doctor visit, right? How many people lie to their doctor, right? How many drinks did you have this week? What percentage of the answer to that is a lie, right? So then now you get people into a group visit, and suddenly people start to be more honest because they see other people that are just like them. And he was saying that he had started doing virtual group visits, and he had patient one after the other take their, you know, didn't tell people ahead, take their computer to the fridge and go and see what was in there.
Yeah.
And I think the window into people's actual lives is very, very interesting, because we practice a medicine that, the biggest determinant of someone's health trajectory is probably what is in that fridge right now. And ultimately, I wonder whether, you know, having an access into a place where people are radically more honest, or you can actually see what's going on, might be a benefit, given that the kind of medicine that we're looking to practice is something that is trying to tweak people's environment towards health.
Well, I agree. And it's not just the refrigerator, but it's also when you have a senior and you're like, well, you know, show me what your bedroom and bathroom look like. You know, how easy is it for you to get around, you know, getting in and out of your bed? I mean, there's a lot of ways when you can get insights, because I mean, I used to do a lot of home visits, and I was a midwife before I was a physician. So I was always in women's homes, and it's something you miss a lot when you have an office and people come to you versus when you would go to their homes, right? When you were going into their homes and you were there not only for prenatal visits, but you were there for the birth of a baby in somebody's house. It was a very different experience than an experience where they come in and you're just sitting in two chairs for 30 minutes in your environment, in your space. So I think that's a great point. I love that. And I think that might be think about the people that you could do when you just maybe schedule a 30-minute nutrition visit, right? Let's go through your pantry. Let's go through your refrigerator. Let's look at things. What's on that label? I mean, you can see how nutritionists and other people might be able to really use this telehealth and telemedicine in a way that is very new and very different and easier than having to drive to everybody's home. So
yeah, no, absolutely. I think that's a great point. So I want to go a little bit deeper into, you know, obviously the conversation on, you know, you've been very strong as part of the AIHM and sort of leading in that organization, which is a big tent organization for integrated providers. Today, you know, for the last few years, I've done the IFM pre-party, right, where we had a pre-party at the event, and this is kind of like a shoe-in for that. So you know, this is that moment. I once came up with a phrase. I don't know, maybe this is insulting, but I thought that, you know, to me, for this movement, like the AIHM is the heart, the IFM is the brain, and the A4M is the face, but it's still the same person. And I've always wanted to just, you know, I've been on a mission, I guess, with the Functional Forum to kind of bring these groups together and help them to see that this is all one kind of family, a family that believes in lifestyle. And you see lifestyle medicine, naturopathic medicine, there's so many different names, it's confusing to everyone. And I guess I just would love to tap into your thoughts on unity and solidarity in these times, because I know even a lot of the organizations are especially the ones that are businesses that or that are conference based. It's not an easy time, and I just wonder whether this shift in inertia could be something that could bring our whole community together. And I would just love to get your thoughts on why that hasn't happened, and possibly like how you see it might be able to happen in the future.
Yeah. So the tribalism has been interesting to watch over the years. And, you know, you see it with lay midwives versus nurse midwives with OBGYNs. We saw it with integrative medicine and functional medicine, right? So, and in New Mexico, part of the resistance to naturopaths was our acupuncture group. You know, here we have very strong, one of the broadest licensing for acupuncturists in the country. And it was always very interesting to sort of be sitting there and watching where the resistance comes from. And, you know, a lot of times it just seems to come from scarcity. Like there's just not enough to go around. Like that somehow there is not enough suffering and hurt and people that need care that we all can't just be involved in it, because even with all of us, if you line us all up, all the naturopaths, all the massage therapists, all the, you know, physiotherapists and the chiropractors and the MDs and the DOs and the DCs, everybody, we still will not be able to care for everybody who needs care. So I would say the first thing is to get away from this scarcity kind of mentality that there's like, that somehow we have to protect our piece of it. The other thing I've seen is sometimes there is, I think there's tremendous value in some of the different ways people come at it, because it's like with adult learners, not everybody learns the same way. Some people are more visual, some people are more auditory. So with integrative medicine, when I first started to work at the University of Arizona, it was very much a lot of mind-body medicine, a lot around spirituality, philosophy of medicine, ethics of medicine. There was this, you know, just tremendous piece of this. And then there was some nutrition and some other things that came in. Many people, when they left, said, oh my God, I love what I've learned. I'm not quite sure how to put it into practice. When I went to functional medicine to several of the conferences, when I was invited to go, it came from a base of biochemistry. A lot of it was sort of a biochemist's, Jeff Bland's and other brilliant people's way of sort of looking at the roots of disease, not just all the branches, but really getting at the roots of what's going on. And I found that a lot of clinicians really resonated with that, because it felt sort of familiar to what they'd already learned, and it made sense to their scientific minds. Well, I thought, boy, what if functional medicine and integrative medicine got together and had a baby? I mean, like, what would you have? Like, you would have this amazing sort of root biochemistry, sort of this whole piece merging with this really sort of broad, holistic way of thinking very much about an individual. And I thought, wouldn't that just be so cool? But what was interesting at that time, before I went to AIHM, was that nobody really wanted to play together. You know, it was kind of like, we're over here doing our thing and you guys are over there doing your thing. Yeah. And what was funny to me was that our fellows were going to functional medicine people were signing up for the fellowship. And so clearly, I think everybody kind of wanted all of it. You know, I'd love to know your thoughts, James, but for me, you know, my children call me mom. My husband calls me sweetheart. People that can't pronounce my first name call me Dr. Low Dog. My parents call me sweetheart, right, honey, baby. But I am the same person.
Yeah.
I'm the same person. I have all these names that people refer to me as, but I am just the same person. And I think that's what you're trying to say, is that there's a lot of different names that we're calling something. And for me, each patient sort of finds in their life what they're most drawn to, and the practitioner that they're most drawn to. Because I'll also say this, that it's not just profession or modality based, but often this is the individual clinician, the person. And it's like, I just went to that acupuncturist and I just resonated with her. And I love her, and she's going to be like my primary.
Yeah.
And it's not so much she's an acupuncturist as that something connected for us. And I feel like she can help me, and we have this relationship. And so, you know, I think when we're thinking about unity, it's about recognizing that I want to be proud of my profession and what I do, but I define myself as a healer, and all the rest of it is kind of fluff. And when I say healer, because some people are like, wow, you know, people heal themselves, and I'm like, well, you know, healer is a powerful word, and it means that you have to really take a lot of responsibility for self. We always know that people heal themselves, but if you're in the healing profession, you're a healer. And then everything else, midwife, doctor, massage therapist, all these other things that I've been and done are very secondary to that. So I pray for unity. I pray for us to realize that we're all brothers and sisters trying to help people, and that no matter how much work we all do, there is more work that needs to be done than we can ever possibly get done. And it will take all of us to do it. All of us.
Yeah. Well, I'd love to share just with you my thoughts on this, because this has been a journey that I've been on, you know, for the last 6 years. So, you know, before I started the Functional Forum, you know, I went to all kinds of conferences and I saw all kinds of practitioners, from like the Reiki person who's practicing in their own garage, right through to some, you know, doctor in a medical system who doesn't really know what this is, but their wife got better and they want to know, and like everything in between. And one of the things that I identified, which is in my mind was a problem, was that if you look at, say, yourself, Mimi Guarneri, David Katz, right, 3 leaders in the integrated medicine, you're doing things totally differently, right? And to me, what was needed, what I saw was like almost like a common language, right? Could we have a common language that we could learn to speak? One, so that there could be some sort of like standardization. But 2 is because like ultimately we could see that this was going to have to be delivered in teams, right? You couldn't have Dr. Low Dog telling you not to eat gluten because she's too valuable for that, right? You need to have someone who's a health coach could do that, and it would just be just as valuable and cost like maybe 10 times less per hour. And so ultimately when I first, and this was just my experience, I had heard Jeff Bland lecture in 2010 for the first time, and I was like, hey, there seems to be like doctors in here nodding along, like this seems like doctors would get this. And then I saw Christy Hughes lecture once, and I saw the matrix, and I saw that the timeline, and I saw the healthy behaviors at the bottom, and I just thought, this seems like the most likely common language that we could get into, because even in there you see, okay, structure and function is one of the pieces of the matrix. So if that's low, get them to a chiropractor, get them to a PT, get them to a acupuncturist. But ultimately what I saw from like an economist point of view is sort of like a prioritization system where we could prioritize which integrated modalities would work best for that individual person in front of you. And that's why I called the show the Functional Forum, because I wanted to share, I wanted us to have a common language. And ultimately what I see one of the roles that I'm playing in functional medicine, hopefully at this point, is taking functional medicine away from tons of labs and supplements, and that just being what people think of when they think about functional medicine, because they do, but actually thinking about it as a common language and having integrated providers come together. And what is possible when we have a common language? One, practitioner teams, right? A health coach could do an intake and pass you that intake in 5 minutes. You could get almost an hour's worth of information really quickly. And then two, obviously the thing with JAMA, with the Cleveland Clinic results, like that's again what's possible when you have everyone speaking a common language. And that's been my journey. And later this year, we're going to be rolling out some technology to help meetup groups thrive even more, because we really sort of made it our mission to get practitioners in a room together locally so they could see that they're very similar to each other. And so that's, I guess, we've never really talked like this. So I just wanted to share, this is what I've seen, and I'd love to get your thoughts on that.
So I love it. And you're right in the footsteps of like Sir William Osler, right? So Osler, one of his big things at his time was, he said, look, lots of people have different ways of treating things, but we don't have a common language around diagnosis. So for him, it was, there's no way, you call it this and we call it that, and you're calling it this over here, and there's no common language around the diagnosis, right? And then a homeopath, which were prevalent at that time also, then it's like, if you want to use homeopathy, you use homeopathy. If you're going to use surgery, you use surgery. But he spoke at length about having to have some sort of common language by around which people could communicate. So when I first opened my treehouse clinic in Albuquerque, I had a psychiatrist and a social worker at MSW. I had a PhD in nutrition. She was amazing. I had 2 chiropractors, a couple massage therapists, and a wonderful acupuncturist, doctor of Oriental medicine. So here we were in this treehouse clinic, and we would have our Wednesday morning, get-togethers, and we would talk about some of our patients. Well, I read a letter that I had received. Her first name was Genevieve. I remember her very well. She was a 57-year-old woman who'd come into the clinic, who'd had a number of health problems, and she'd seen me, and then I sent her to the nutritionist, and then she went to the chiropractor. Well, then she went to the acupuncturist. So she wrote me this letter that was very interesting, very nice, but pointed. And she's like, Dr. Low Dog, I really enjoyed meeting you, and I really like the concept of your treehouse, but I won't be coming back. My whole reason for coming was I thought I was going to be getting kind of a coordinated care where everybody was working together. And I was told I had a certain type of problem by the chiropractor. My nutritionist put me on a specific kind of diet for my cardiovascular disease, but when I went to see the acupuncturist, she told me, oh, no, you need to do this, this, and this. And she also told me there was something really wrong with my kidneys, which you told me there was nothing wrong with my kidneys. Of course, it wasn't her kidneys, it was her kidney, in Chinese medicine, sort of her kidney energy. Yeah. And I brought this to the group, and I said, well, now this was kind of interesting, wasn't it? I mean, so we're here all trying to work together, and we're having our Wednesday morning meetings. And here we have a patient that just basically said, I wanted you guys to all work together, but you're all talking different languages. Mm-hmm. And I actually brought in an anthropologist to work with us. And it was interesting. People are like, why an anthropologist? And I said, I actually wanted a cultural anthropologist to come in and work with our group on what do you do when you have multiple cultures working together? Because we were multiple cultures, different professions, with different ways of talking about things, different ways of diagnosing things, different way of talking about things. How do we come and work together? And she worked with us over several months, actually, to create a common language that we could use also with our patients and as well as with each other. So when you talk about language, it's just very interesting, because that was a very powerful experience for us, really committed practitioners doing an integrative clinic in 1998 in Albuquerque, who had a patient say, it's a great idea, and you guys are all over the place. And it makes you wonder how anthropology could help us, how anthropologists and social sciences and others outside of our science, outside of our dimension, might be able to bring us insights that could be very valuable when we're talking about a common language, and the importance of having a common language, but the importance of everybody maintaining their own, right? So we're losing lots of languages just around the world. People are losing languages so we can all speak English, right? But there is something very powerful that's lost when you no longer speak your language. So we want a common language in our domain, but we want our acupuncturists to still keep their language. And we want chiropractors to still have their language. And we want the naturopaths to maintain their language. While we're probably all going to have to be multilingual, but we don't want to lose our own, because there's a richness to our profession and our practice that is expressed in the words that we use.
Absolutely. Yeah, there is a richness, and I agree with that. And I think that, I'm not sure if there's a good metaphor for describing that sort of the contrast there, but I definitely I hear you, and I think that certainly you know, organizing practitioners to work together is really critical. And I do see there are people showing up now. You know, I've met in the last few weeks engineers who have reversed their chronic illness, and like they feel like they have something to bring to the future of this medicine because they understand systems biology in that way, and other people coming in. So I'm very clear on that. I guess I wanted to just ask you, you know, if COVID hadn't happened, you know, I wrote this book, The Community Cure, because I wanted to spend this year and the next 10 years penetrating penetrating conventional medicine, right? Getting this medicine in. And one of the things that I saw with the group visit is that it was like profitable to deliver, which was going to be a big deal for profit-making hospitals and systems. It was efficient. And, you know, at the Cleveland Clinic, I saw that you know, PAs were able to start delivering functional medicine with 6 weeks of training and get amazing results because there was a set sort of structure for them to go through. And I guess COVID happened and not a lot of group visits are happening, you know, for a while in hospitals, and no non-COVID care is really happening either. But I guess I just wanted to touch in with you to get where you feel like, where do you feel the slots are for integrative functional naturopathic medicine, for this medicine to really take this opportunity to penetrate into conventional medicine and become a standard of care?
So it's an interesting question. It's in so many places right now, but separate, not equal, right? So there's a lot of integrative clinics in a lot of places. Cleveland Clinic, an exception, but you also have had some rock star people there, you know, leading that, Mark and others. But in a lot of places that I have visited, the integrative clinic is kind of here, and it's kind of the stepchild. And I don't mean that in any kind of way around stepchildren. I'm just saying that it's not a part of the whole team. We saw this at the U of A, even with a powerhouse like Andy Weil. We were always the outside person. So bringing it in, I think, is going to be a lot of like the movements that we've seen in the past, civil rights movements, women's movements. I mean, I think there's a movement afoot for people to say, you know what, I thought some of this was pretty good in with my doctor or my nurse practitioner, but I want more care. I want somebody to talk to me about my diet. I want somebody to help me with my stress. I want another way of thinking about pain other than just more Percocet. And I do believe that this is going to be an opportunity not only for us that are in the fields themselves, but I think that this will also be a public movement, just like you're seeing with the protests with George Floyd. Civil rights didn't end in 1960. It's an ongoing process. Conventional medicine isn't just going to tomorrow be integrative and functional and all of these things. It's going to continue to be iterative, but it's also going to be a demand by the patients themselves who say, you know, I have a brother right now who's been in and out of the intensive care unit, but not out of the hospital for almost a month now, and in renal failure and liver failure and other things that are happening to him. And a nutritionist has never seen him. And here's somebody who's on a renal diet, you know, but whose labs are all over the place. He had no physical therapy, so for 4 weeks has been in a bed with nobody coming to actually do anything like to prevent bed sores, to, you know, do passive range of motion, to get up and up in a chair. I mean, and so here I am on the phone negotiating with everybody, trying to get more things for him. And it's like it's like this should be part of conventional medicine. This should just be part of what you're doing. And the fact that nutrition is so far off your radar, that movement is so far off your radar, that even talking to him just as a person about like his fears right now, nobody's done that. I think that patients and people are going to just stop once they taste what this feels like. When they get this experience and they feel better, it makes sense to them. Who doesn't think diet matters? Who doesn't think that managing your stress matters, or that you need a good night's sleep? I mean, everybody knows this, and pretty soon people are just going to start saying, especially with your $2,500 copayment, you know, that you have to pay, they're going to say, I want more services for that money, and I want to be able to spend that money in more ways than you have just said I can spend it. So I'm optimistic about it, James. I'm optimistic as a woman who's seen the women's movement, as somebody who's watched the civil rights movement, as somebody who's been integrative medicine by all its different names for almost 40 years now. I see the shift and change, and it's iterative. It's never fast enough, but I think that there is a huge swell that's happening as this country becomes more stressed, more overweight, more sick, more depressed, more pain, soul pain, physical pain, and others. People are just going to say, I'm tired of just taking an antidepressant and taking a pain pill. I want something more, because my life is worth more than this.
Absolutely, yeah. I think that's true. And I think there's also a great moment here for disintermediation, right? Where you could just get rid of all the middlemen, the insurance, the primary care, the specialist, all these people that had to get you to a person where you could actually like have a conversation and work on your like stuff, right?
Yeah.
That would be an opportunity to get all those other people in the way and like look for those things. You see the growth in the direct primary care movement. It's really exciting.
Yes.
I don't know if have you ever come across have you ever come across Paulette Jordan? Do you know that name? So if you haven't, you're going to love this. So she is running for the US Senate in the state of Idaho. She was 40 years old. She would be the first Native American woman ever to be in the US Senate. And her health platform, which everyone can go and check out, which is pauletteforsenate.com. She's running as a Democrat in Idaho. She won actually just last week, the Democratic primary, and now she's going in November. But her platform calls for basically the dismantlement of the current healthcare system and a new system to be built on integrative and functional medicine. And it was just so amazing to hear that come out of the mouth of someone who's in politics, because I feel like many of us in this world really, they talk about, oh, how is medicine going to change and who's going to pay for it, and the people paying for it should be different. And ultimately, I think it's almost like you want to wring someone's neck and say, look at what's happening. Like, this is where the future of chronic disease happens. And I can't help but think that this COVID moment, which has unmasked the fact that the cost of all of these chronic diseases that, obviously people are realizing it's a lot more of an acute issue than it ever has been, because now it's acute because people with those issues are dying at a higher level, that maybe this might be a moment where leaders like Paulette could stand up and be heard, and possibly, we could see more of a wholesale change.
Well, it will take it, if you're going to do it quickly, you want to get there fast, go alone. You want to go far, go together. And so we want to go far, because whatever we're going to dismantle and recreate, you have to be very thoughtful about what you're recreating, because there's a lot of interests, a lot of special interests, and a lot of money, and a lot of vested interests in keeping the status quo in medicine. And so it's going to take a strong leader, and it's going to take a group of people that will really help support that. But a little story, just because it was kind of interesting. I was on a panel, quite a few years ago, and it was here in New Mexico, and there was a Lakota man there. There was Pueblo. There was a series of practitioners from around the country. And one of them was asking about, somebody in the audience, a doctor was asking about, well, what kind of evidence? I mean, because, one of my problems I have is when I work at Indian Health Service and, and it's like people are coming in and they're doing all these things, like what kind of evidence, like, can you really show? And I was really tickled when this Lakota man, this physician, just looked at him and he said, we have thousands of years of evidence. We just want you to show us what your evidence is before you come in and really change up things that we've been doing for so long that's been working. And I just thought it was really precious because it kind of turned the whole thing upside down, right? It was kind of like, we hear this so much, where's your evidence? Where's your evidence? Where's your evidence? And it's like, it never matters how much evidence you have. Yeah. We have so much evidence right now. It's unbelievable. And people still say, but there's no evidence. I think it's going to take a major paradigm shift. And evidence is used like a weapon to either prove your point or disprove that somebody else's evidence is of no good. But I'm optimistic. I'm going to go check her out, and
I'll send you the interview. You'll like it. Well, look, I guess, I just wanted to ask this question because, when we were starting the Functional Forum and we realized like we wanted to help doctors make the switch to functional integrative medicine, and we needed partners to help take us there. And we saw, Fullscript, it used to be called HealthWave back then. And we were like, look, I feel like if practices are going to go online, they're going to have this digital infrastructure. We need to make it easy for people to get supplements. I'd worked in a clinic and just saw how cumbersome it was to send stuff out. Like you could align, yourself with anyone, right? In this industry, everyone would love for you to be on their medical advisory board, I'm sure. And now you're coming into the Fullscript community. I mean, apart from your relationship with Jeff, what is it about this organization or about Fullscript that makes you want to be part of this team?
Well, I actually was very impressed when I met Alex and Jeff. I have a high regard for Jeff. I have always had herbal tinctures and mixed and blended and always had supplements. I mean, because in clinics, that's what you do. It also is hard to maintain all that inventory and to keep everything up. And I loved the concept of being able to have storefronts for people, clinicians to have storefronts. They could sort of select what they wanted for their patients. And I also really loved, and I liked the, all of the criteria to, if supplements are going to be sold there, the quality criteria behind that. That's something that's always been important to me. But also that a practitioner could have sliding scale, right? So they could pass on part of their profit. If you're working in a lower income environment and you just want to sell it at your cost, you can do that. Patients can go on and get it. I find that one of the most challenging things for a lot of clinicians is, how do I know which products are quality? How do I tell patients which ones to use? And I think Fullscript is able to deliver a complete digital solution for clinicians who do use supplements in their practice, and can do so without having a huge inventory overhead, without having to stock them if they don't wish to, and being able to have it all where their patients can have it sent directly to them, et cetera. So I've been with the USP, the United States Pharmacopoeia, I just was elected chair again, just a couple weeks ago. So now I'm in my 22nd year at the United States Pharmacopoeia. So quality is a huge issue to me. And so that was one of the things, is like Fullscript, their commitment to making sure that products make sense and that products are high quality, so that clinicians don't have to spend all their time worrying about that. It's already been pre-vetted. Absolutely.
Well, look, I thank you for that. And I guess I want to thank everyone who's listening to this as well. I know we've got a little bit over the hour. There's been some interesting questions coming here, and I think it speaks to actually what we've been speaking about here today, Doctor, which is that I just want to pull out one. Anne-Marie Tourlet says she became an RN to help people get well, and now at the age of 64, she has graduated to get on board with integrative and functional medicine because she sees how important that is. I see, there was one interesting question here that you might be able to help on from my friend, actually, Ashley Koff. High five to you for being on here. She says, do you know any organizations or practitioners providing integrative and functional medicine to police officers? I'm slightly obsessed with the concept that improving their body's abilities to recognize and address stress would improve outcomes. And he goes, I recognize it's a whole issue, but something that was just available. Like, I wonder whether, better decisions under pressure might be available to people with, some integrative and functional help. Do you aware of any organizations?
And I love Ashley Koff too. So hello, Ashley. I think it's a fabulous question. I don't actually personally know. I know that like we have emergency integrative medicine that gets mobilized here in New Mexico when there's emergencies, when there's traumas. That's available in New Mexico in our part of our medical reserve kind of thing. And acupuncturists are involved in that. And you wonder if those concepts, that those groups could be mobilized not just when there's a shooting or a disaster, but what about going into very high stress jobs like the police, where they're often, my grandfather was a sheriff, and he used to tell me that the most dangerous thing that he was always afraid of was stopping somebody at night for a traffic infraction. And I said, well, Grandpa, why would that make you afraid? And he goes, because it's nighttime and you're walking up to a car that you don't know who's in it. And he said, and you could hear him feel the stress of what that must be like. So I like Ashley's thoughts around that, because I think sometimes it's very easy to see that some of the police have behaved badly without recognizing that most of them are doing a good job, and they're doing it under an incredibly stressful situation. And could mind-body practices, could meditation, are there things, EMDR, are there a series of things that could be done to help them manage their stress, enhance their resiliency? And, for me, meditation was always one of those things that, one of the things I always believed it did for me was it gave me a pause between my thought and my reaction, right? So something happens and meditation gives you that pause. It gives you that space. You wonder, and sometimes police need to make split-second decisions, but you just wonder if some of these things, if they were integrated into their training when they're going through training and then doing it ongoing afterwards, it might change outcomes. I think it's a great question.
Yeah.
Ashley, go start something. She's the kind of person that could go start something like that. Ashley
Absolutely.
Koff.
And we've had a couple of questions, Ian. How would you start a business if you didn't know what you're doing? If you were just getting started, I think generously going after to help people who need help in this moment with a vision that, I think that's the best way to start. We've done tons of content on starting a practice otherwise, but imagine if you became the acupuncturist to the police force or got them all meditating or whatever. Just think about the PR of that, right? That there'll be so much to do. So I think if you see people who need help, being able to help them, and ultimately, I think, for a lot of people who are drawn to actually help people of color, and to support. I just want to finish, I guess, with one thought, which is that last year, when I went to go and see clinics and organizations that were running group visits with all kinds of people in a group working together, that my heart told me that it was the future of medicine, not because people were getting well, even though they were, but it was because there was something about getting healthy together that sort of took away all of the different things that people used to differentiate from each other, and actually came back to a real heart connection of who these people were as people. And everyone, is having really stressful lives, and they each have things that are going on. You listen to them and you empathize with them. And so that's why I'm committed, to that. And I hope that we'll get back to some group visits sooner rather than later. But yeah, thank you everyone for being here. I know that this was billed as a telehealth webinar. We've done a lot of stuff on telehealth over the last 3 months. I only have one chance to interview you, Doc, and so I'm just really wanted to just get into the heart of the issue. And I feel some of the stuff that you've covered today is is I think what really people are yearning for at this moment, which is how do you really engage people? How do you facilitate people to bring the locus of control to themselves, and how do you create those hooks in people to facilitate change? We really need that, and I acknowledge your leadership for the organizations that you're working with, and I'm really excited about what we can do at Fullscript in the future. And thank you everyone for being part of it here today. So I think that's it.
Thank you. Thank you.
So thanks so much for being part of it. Check out, we'll be sending out the replay. If you look in the chat, you can see links to where you can go to get a Fullscript account, where you can go to get the webinar tomorrow. The replay will be up. I'll tell you the site here right now. It's fullscript.com/webinars. We'll get that up as soon as possible. Thanks so much for tuning in today. I'm your host, James Maskell. We've been here with Dr. Tieraona Low Dog, and we'll see you next time.
Thank you. Thank you, everyone. Be well.